everyone, and welcome to the third and final session of today's second Clean Sport Insight Forum. So you will have just been able to watch the recordings of Mike Earl from World Rugby, Rebecca Lee from UEFA, and Helen Staff from Leeds Beckett University. And we are delighted now to welcome them onto the panel today, along with Colin Allen from UK Anti-Doping, who was in partnership with Leeds Beckett for the development of the parent curriculum. And we are really thrilled to have our panelists join us today, because amongst them there is a real wealth of experience, of learning, of insight that we hope to draw upon today through the question and answer session. And as part of the Clean Sport Alliance, as Mike alluded to in his presentation, what we really are trying to do is create a network where we can share the learning of the practitioners and the researchers in order to help develop education that we hope can be as effective as possible. And I think if you've had a look at the Clean Sport Alliance website, one of the things that we've emphasised on there is it's about emerging practice. We've been very purposeful in not stating that we are showing good practice or best practice, because when we are dealing with such complexities as clean sport and the myriad of behaviours that we're trying to elicit and encourage through our education programmes, then learning is what it's about, and we'll change our knowledge and understanding over time, and therefore sharing that as kind of in as timely fashion as possible is really critical. So it's emerging practice, and we've got emerging practice being shared here from international federations and from partnerships between research organisations and national anti-doping organisations. So I think I'd like to start by firstly thanking our panellists for giving of their time today. You know, for a network to work, it needs support and it needs energy and enthusiasm, and the panelists today have certainly got a lot of that, and we're really grateful to have them join us. And I just want to start with asking the question to all the panelists. You know, we're all awaiting the international standard for education coming into force in January 2021. And I'm really interested to hear from each of you on the opportunities you think the implementation of that standard really provides for clean sport. Mike, do you want to start us off?
Yeah, I think most of us on this call are here because we understand the value of education, and you know, the fact that this is the first time that we have an education focused standard is a big deal. And you know, I've been doing this for a long time now. My role is has always been a mix of testing and education, and I think, you know, in most cases you don't stop crime by building more jails. So testing's great, but it's not really moved on in terms of preventing doping in the years that the code's been in existence. So what education allows us to do, or what the standard hopefully allows us to do, is just shift the narrative a bit and shift the focus a bit, so that gradually, you know, we can start to move more funds towards education, more funds towards prevention, and move away from this idea that testing is the only way that you can keep sport clean. So, you know, I think it gives us the platform to do that. And we have a great opportunity now, all of us who work within this area, to make use of it. It's important that we do it properly, that we don't just dive into it and start ticking the box that it's a numbers game. And yes, we've done all our education this year. Great job. I think it's really important that the people that are in this group, the engagement that we have between the practitioners and the researchers, that we get this right at the outset, so that as we start to build programs worldwide, we do that in an informed way, and we can make it as effective as possible. So I think it's a great platform. It's a great opportunity.
Brilliant, thank you. Becky, do you want to follow on?
Yeah, I think on my side, really, that the ISE has provided a focus and a direction of our work. I think a lot of anti-doping organisations were doing a lot of education beforehand, doing obviously a very decent job, but I think the ISE has steered it in a more collaborative way. It's really targeted what we should be doing at an international level, at a national level. And the other thing I think that the ISE has brought is, historically, the education pillar has not been funded in the same way that, let's say, testing and results management has been funded. And I think making it mandatory hopefully will funnel more funding in from the top, to make sure that it really holds its own with the other pillars within anti-doping. So I think
important, because we've talked around it
very
quite
much
a
so,
long time, haven't we?
Yeah.
The resources and quite the differential in where those resources go. Colin, what do you think is the opportunities from a NADO perspective?
Yeah, thanks, Sue. I think in addition to what Mike and Rebecca have just said, for us, we've been delivering education for 10 and 11 years, and the IEC has given us now an opportunity to take stock of good practice and look at maybe doing things in a slightly different way. We've had a chance to look at our athlete pathway, had a chance to look at our curriculum, and a chance to re-engage again with the national federations, with a requirement now to be involved in the planning of education to help to improve what we're doing and take our education to the next level to support our clean athletes.
And Helen, if we bring in the researcher perspective, the international standard for education has brought that into sharper focus. So what do you think are some of the reflections of the opportunities it affords from the researcher side of things?
Yeah, and I think so. I think that's been really important, and I think exactly like the other panelists have said, in terms of that driver and that impetus all of a sudden around education, and that driver now to work collaboratively across the field, rather than there being two separate pockets of research happening and it not being accessible and available to the practitioners, being able to sort of work together, like we did in terms of the project within UKAD, being able to share that kind of really provides an opportunity for organisations from the ISE to be able to be given alternative perspectives and lenses into what maybe they've already been doing, and the great work they've been doing, and kind of capture that with a sort of theoretical lens and bring that evidence-based side, because I think there's a lot of anecdotal evidence within the anti-doping world in that sense, and then so to sort of be able to complement that alongside with theory and that kind of side of things has been really positive, and hopefully will enhance the effectiveness of the education, which again will increase that sort of driver within resources provided towards education across the landscape.
There is a real focus, I think, isn't there, in the international standard around collaboration and developing networks and supporting each other. And I think, Mike, one of the questions that we've just had come in from the Q&A was great to hear about the plans with World Rugby, especially the coverage across different stakeholder groups, talking there about athlete support personnel, coaches, S&Cs and players themselves. How involved in the development process with those groups? So can you talk us a little bit through that process in that spirit of collaboration, how that's worked for you guys?
Yeah, I would say it's still a work in progress. I mean, as I said in the presentation, we've done this very much as a two-stage process. The first stage was really about getting the framework in place and making sure that our member federations were ready and that they understood that they needed to deliver an education program now going forward, and they needed to do it on an annual basis. So that was kind of phase one. Phase two was very much about the content and the actual information that we deliver and when we deliver it, and that's an area that we're still working through at the moment. I would say, I mean, we have a lot of existing materials, as many organisations do, and our work now will be to evaluate those with our stakeholder groups to ensure that they're fit for purpose. Now, you know, we do work as an organisation. We work very closely with our players union, our international players union, who have links with the national players union, and we're increasingly engaged with them on education. So we've worked with them on the development of this process, also with our member unions as well. So the players have definitely been our focus in phase one, and the education for the players has been the main priority. I think for the coaches and the support staff, the S&C staff, that's an area that we've kind of done to a point previously. But one of the good things about the ASC is it's given us a lot more focus on or made us a lot more aware that we need to provide better education for those groups. And I mentioned in the presentation that we're looking to embed some more role-specific education within our training programs for those roles. So I would say that they are groups that we are going to be working with from here on in. Now we've got our framework in place, and we've just had our policy approved by our union, so we can now start to work with those groups on what the education will look like. So I think to this point, our main engagement has been with players and with our players union, but in terms of the coaches group and the S&C, that's something that we'll be working on kind of now going forward to make sure that as we roll out the programme through next year, we'll be able to give them content that's fit for purpose and meets their needs. But there's also, without going on too much as quickly, there's also the research side as well. You know, we need to do a little bit of evaluation of what we're providing at the moment, just to check that that is actually doing the job it's meant to. So there will be an element of that over the next year or so, just to do some evaluation on our existing materials.
Yeah, and I guess, Becky, following on then from what Mike's just shared from World Rugby, has UEFA followed similar processes in terms of engagement and collaboration, or have you adopted a different approach? I mean, just building on what you gave in the presentation, I think one of the things that you'd highlighted was that the focus, and has that kind of represented your efforts to some degree?
Yeah, I think the engagement on our side, we're just starting to do it. Similar to Mike, we kind of made the initial plan, which almost is what we have to do in terms of the IC. But now we're starting to develop the materials that we're going to deliver and give to our educators. And we're working with yourself and with Laurie on that. But in order to make sure that what we develop works on the ground, we are engaging team doctors who are, I think Mike mentioned, a crucial stakeholder for us, and also engaging players as well. And one of the key things that we want to do is not just make sure that whatever education we develop works in England, France, Germany. We also need to make sure that it works in Eastern Europe as well, because UEFA has a huge reach across Europe. So we need to engage football players and doctors from a broad range of national federations to make sure that what we do really works for them. So the first point of that is we've got a stakeholder group, an expert group with 3 former players and 3 national team and club doctors, so that we can really challenge what we're intending to implement, so that we make sure that really it does work for them. So yeah, I think for me, it is crucial to get them on board from day one, really, and not make assumptions about what they need.
I think that's critical, and that came across, I think, quite strongly in the first session of today's event, you know, from our athlete researchers, excuse me, their reflections of their involvement quite early on in this research process gave them some learning and new perspectives that they then brought into the research. And I think you're kind of probably experiencing the potential for that with engaging stakeholders really early on. And I think I just want to bring Helen in from the perspective of focusing on parents. You know, how was your engagement in undertaking research with parents? How did they engage in that process, and how did that to some extent shape that curriculum?
I think that's what's really important is across the landscape, I think we often see parents as that external. They're a little bit further and more removed from maybe the medical staff and the S&C and the coaches in that kind of respect. But what was really important when engaging with parents is their motivation and their drive as to want to be there. So ultimately, they're driven by the welfare of their child. They want the best for their child. So they're a really important stakeholder in that sense, in terms of focusing on that. But I think where the limitations come is potentially, like Becky was alluding to there, about knowing what they want and what they need, because they're a really different kind of niche population. And so their requirements around sort of clean sport education and clean sport behaviours are potentially very different to the organisations and the stakeholders that we've worked with previously across anti-doping. So I think they're there, they're ready, and they want that information, and they're ready to use it. But I think there needs to be more from a research and practice side in terms of really understanding what it is they want and how we can facilitate them to support the clean sport environment.
Thanks, Helen. And I think coming to Colin, you know, we've talked about in the earlier sessions around the complexity of the behaviours that through our education we're trying to instill or sustain or potentially change. And there are many different stakeholder groups, aren't there? The complexity of the behaviour is also to some extent then reflected in the complexity or the reach of our education programmes. So Colin, from UKAD's perspective, how have you managed all of those multiple stakeholder groups and kind of that complexity part of things in developing those education plans? You know, what has been your process to date that you think is getting you ready at this point?
Yeah, we're quite fortunate. We've got a fantastic team with specialisms in terms of our experience working within school systems, working in sports science, working with elite athletes, working with the university sectors. And what we've done is try to build those bridges and speak to those people within those sectors who are on a daily basis working with athletes and other populations as well. The view to really do a bit of a sense check is what we've got fit for purpose, and we're now more acutely aware of the need to pilot material before it goes live, and that's what we're trying to do right now.
Thanks, Colin. We've got a few questions that I just want to pull in from the chat function and the Q&A function of the platform. And just to say that we've already today got over 130 participants joining us via the platform and also via the live stream. So thank you to the community for engaging and being part of today's forum. That's really very much what's driven the establishment of this network and what we're hoping to do in the future as well. One of the questions that we've got come in was around the recent developments. You know, education is also situated within its context and within an ever-changing context of the world of sport. And one of the questions we've had posed is, given the recent developments in the US, who should be mainly held responsible for doping? The athletes or their doctors, managers? Who would like to provide their reflections to that question? You know, where should responsibility lie for what is this complex behaviour that we're trying to intervene to prevent?
I'm happy to start if you want to.
Go on, Becky.
There's got to be a joint responsibility. On my side, we have to have strict liability for the athletes, because ultimately it's their body and it's them that's taking the substance. But particularly in football, so much of anti-doping is delegated to the team doctor. I think when we catch people for doping, when we catch people who've taken substances, usually it's something that they have done on their own. So it's something where they've taken a supplement or they have taken a substance that their doctor wasn't aware of. So in that instance, it does have to be the strict liability, but then also there has to be a recognition that particularly in team sports, I'm sure Mike will support me in this, that there does need to be a joint responsibility for the players and for their team doctors particularly, because they do have such a key role in that. And I think that's something that when we're talking about education, we also need to really make sure that we target the team doctors and the support staff around the players to make sure that they have all the information that they need to support the players to stay clean as well.
Mike, was there anything you wanted to add to that?
I think Becky's probably covered it pretty well. I mean, Becky's right in the sense that with a team sport, there is, I mean, there's an entourage for every athlete, but there are so many different people surrounding the athlete within a team sport and teammates as well. And, you know, we all, everyone on this call will know that you know, that there is an increasing awareness about the environment around an athlete. So it would seem reasonable that we should be moving in that direction where we are putting more responsibility for clean athletes on the people that are supporting them. So, you know, as Becky said, you can't get rid of strict liability. It has to be there. Otherwise the whole system falls down. But we definitely seem to be moving in that direction, certainly with the new code. and with the work that's going on in education and on research. So I think, in simple terms, yes, we should be putting more responsibility on others. What that looks like from a regulatory sense, I'm not entirely sure, but I think the principle is definitely there. If we can add more pressure on those around the athlete, then that would seem likely to create a better outcome, particularly if it's putting pressure on people to, or at least raising awareness of the motivational environment and the things that influence the athletes to do.
Mm-hmm. And just moving on then to another question that we've had posted from our participants. We've asked, within higher education, acknowledge that there are different learning styles and different ways of engaging with education material. How will that be accounted for within curriculum development, and what are the plans to try and address those different preferences for learning and education interventions? Colin, anything you want to raise there?
Yeah, and that's a really good question. It's something that we're looking at. I would imagine most people are familiar with the term blended learning, in that people will learn in different ways and will have access now to online delivery. Obviously, because of the current pandemic, we've had to really switch and change the way in which we deliver education. And we're certainly looking at scenario-based learning as one aspect, is put it in the context of the athletes, and bring out some of those values-based discussions to help with their learning understanding, and make sure we've got almost like a toolkit, lots of different ways to deliver subject matter using quizzes, case studies, role plays, all sorts of different things to tap into the needs and make sure that within any session we use a blend of different types.
And just a quick reflection on that. When the discussions of the standard came forward, we were not in a COVID world, and actually now we are, and the world around us has changed. Potentially, we may retain some of what has been instigated because of COVID in the future. And any reflections on how that's impacted on your development of plans? Have you taken that into account at the moment, or has it not necessarily changed the way that you've thought about the implementation of that standard?
Yeah, if I may,
yeah.
From my point of view, for example, a lot of our material now is going to go online, which means that our reach and the accessibility of education is going to be widened. But what it also means is that in terms of the face-to-face or online kind of webinar type discussions, we can cover the facts-based information through an e-learning module and then get into a conversation about what exactly does that mean to you as an athlete. So that's just one example as to how the COVID world's actually given us new opportunities to think about how we engage with people.
Yeah, and Helen, just bringing in from that, in terms of the parents' preferences, was that something that they actually spoke of through the research that you'd conducted?
Yeah, I think that's something that's really important, especially as I think, originally pre-COVID, maybe face-to-face learning was always seen as the gold standard, and online education was potentially at second best or second rate. And I think we hopefully can start to see that movement, that there are those benefits. And from a parent perspective, their drivers really, it's around that self-directed learning. They know they've got something to do, but they want to know how to do it. And they've got all these barriers and factors behind them, and sort of implications that are preventing them from potentially being those, I suppose, bums on seats in face-to-face learning. So actually they'd much rather prefer that sort of online accessibility to resources where they can, so they can kind of pick up and take things on board when they need to, and it's there when they need it, rather than it kind of being something that they have to go to and it being that negative viewpoint of anti-doping education, whereas actually I need to know this right now, where is it accessible? And therefore I think COVID, with that movement online that Colin's talking about, I think will be a really real positive for that parent population that we often talk about as being a really hard to reach population.
Yeah, and any further reflections on, because one of the points that's just been raised in the Q&A is, and really highlights, I think, where that emerging practice philosophy of what we're trying to create through the Alliance is important, is the recognition. One of our colleagues has said, I caution against the idea of learning styles. The empirical research on this is that matching a learning style to the presentation of information does not lead to enhanced learning outcomes. You know, so actually drawing upon the empirical evidence base, having those discussions and debates in education is really healthy, and actually something that as we move forward, I really hope we can continue as a network to support and almost to bring in some debating, you know, about the different philosophies and approaches to development of interventions and education. And I think that's going to be important as we start to see those standards brought to life. And one of the questions posted was also around the importance of embedding research surveys into monitoring and evaluation. The question was specifically in response to the Leeds Beckett University UKAD partnership around the parent curriculum, and our plans to have some monitoring and evaluation in place for that. But I'm aware of time, so I think that's probably something that we'd want to follow up on as a further, whether that's a forum or a webinar or a debate. We've got a few mechanisms available to us as an alliance that we might start to utilise. So I think it's a call out to the community who are engaging with us today to ask you to pose some ideas of what you find or would find quite helpful around emergent practice. Because if you note on the website, we've intentionally left that fairly blank right now. When we originally started on this journey, we were going to be sharing some good practice, but things changed radically as the course of this project emerged. So we want to hear from the community, we want to share emerging practice, and we want to share discussions and debates. So that's a call out, and it just leads me today to thank our panelists, to thank Helen, to thank Becky, Mike and Colin for joining us in this Q&A session, to thank them for the time that they've invested in developing the presentations, and we look forward to hearing further reflections and thoughts and learnings as we move forward. So thank you to them. Thank you to everyone for joining us for the first day of our Clean Sport Insight Forum today. We shift our focus slightly tomorrow from emerging practice into creating a vision for clean sport. And our 3 sessions there focus around our research strategy and the Clean Sport Plan, which we hope will very much bring to life that collaborative ethos again of trying to ensure research is informed by those that need to use it and wish to use it. We'll then hear from Tony Cunningham and Amanda Hudson from World Anti-Doping Agency around the World Anti-Doping Agency's strategy and how that education program is developing. And then we'll talk about the sustainment of this Clean Sport Alliance, because we don't want to finish at the end of this project. So we'll hear from that team. So thank you everyone for today. Enjoy the rest of your day, and we'll see you back again tomorrow.